A very pleasant good afternoon to all of our viewers and those joining us via Second Advent Radio. We are delighted, as always, to be with you on the airways of Second Advent Radio and to come into your homes via our two YouTube channels, SLC Adventist and SLC Church channel. We welcome you to another Let's Talk edition. We have been for last week discussing this matter of dental health. We're talking about watch your mouth, not with respect to what you say necessarily, but with respect to how you care it, because as we discovered last week, dental health impacts us in significant ways. We have been speaking with Dr. James R. Edwards. He is the medical director, the chief dentist at the SDA Dental Clinic in St. Kitts. Dr. Edwards is a graduate of the Loma Linda University School of Medical Health and has been practicing dentistry for a number of years. He has given dental service in North America, and now he is in the Caribbean. He has been to one or two other places, but we are so delighted to have you with us this afternoon, Dr. Edwards. And last week, the feedback I received was that the program was very inspiring, and we are delighted. Welcome back to Let's Talk.
Thank you. Glad to be here.
Well, before we go into our discourse for today, we want to invite our viewers to just take a moment to pray with us at this time. Eternal Father and our God, we thank you for the privilege and opportunity we have. Another time you have given us this opportunity to share on Let's Talk, and we are talking about dental health today. We pray that you will be with our guest, Dr. Edwards, that you will grant him wisdom and clarity so that those who listen will be encouraged, inspired, and educated. Grant us your peace and your blessings in Jesus' name. Amen. Well, last week we spoke about various aspects of general dental health. I learned, for example, that we should not brush directly after eating. That one stayed with me because, pardon my ignorance, but I always felt that right after you finish eating was the ideal time for brushing. So I learned something last week. And we also learned that there's a direct relationship between some common diseases such as osteoporosis and hypertension and heart disease and dental health. Today, I want to begin with a question that I probably should have asked last week. So I want to begin with it today, Dr. Edwards. As Seventh Adventists, we put a lot of emphasis on what we eat. So the question is, how is diet in general related to dental health?
Well, the best thing I can think of, and we all know that the best diets for ourselves are the most whole grains, fruits, nuts, vegetables, and in their purest form. And if your teeth are not in proper health, you can't chew raw vegetables, for instance, or even slightly cooked vegetables are hard to cook, hard to eat when you have, a compromised dentition. So dental health is completely related to what you can chew and how well you can digest your food. So it interrelates, just kind of like, peas and rice go together. But you need them both because they're both put perfectly together. They're perfect protein, which is positive for the body. So the same thing with dental health. If you're incapable of chewing and masticating your foods, grinding down to a small swallowed bites that your body can process easily and quickly, then it just slows down all of your health and your immune system.
So you are in fact saying that the diet that we choose to use directly impacts our dental health. If we eat the wrong things, we're going to have a higher likelihood of having poor dental health and vice versa. Am I getting you correctly here?
Yes, especially when it comes to whole processed foods and sugars and complex, simple carbohydrates, not complex ones. Simple carbohydrates are very readily processed in the mouth by the bacteria, and so they use that as a feeding process. And getting into some stuff we'll talk about later about caries and periodontal disease, the processed foods, the sweet sugars, they feed these bacteria, and bacterium are the only main cause of difficulties in the mouth. So,
Okay, I think that's pretty clear. Now, I want to go back to a question that someone asked just as we were closing last week. You were responding to the washes, whether we can rinse or wash our mouths, and somebody was asking how good is peroxide. I remember you spoke about the alcoholic based washes, and now this person was asking how good is peroxide for rinsing.
well, peroxide solutions are in a number of different oral mouth rinses, but the percentage of peroxide you need is between 1.5 to 3% is a safe level for having in your mouth, and you can rinse out for a few minutes and even gargle with it. Some people advocate gargling with it, but you're never supposed to use full strength or what we call fruit rinsing peroxide, or the peroxide that you can use as an antiseptic, because the antiseptic peroxide, when it comes in the brown bottles, is at a 35% basis. So it's 10 times the amount of peroxide that you would need to be safe in an oral environment. So a little bit of something is good. Too much of something or too high a concentration, it can be damaging to soft tissues and throat. It can cause difficulty with swallowing if you ingest it. You can have side effects like nausea, vomiting, and excessive amounts of peroxide can lead to what we call black tongue or hairy tongue, and that's just a over manifestation of bacteria and fungus on the tongue, and it can be that can be cleansed with good proper oral hygiene.
Very useful information indeed. Now today we want to deal with some specifics, and I trust that the person who asked that question last week is listening, because as you were responding to that, I was here thinking, now if you say 1.5% and somebody is using 35%, then that's a lot of damage to the mouth. So I hope that the person who asked the question is listening, and lots of other persons as well. You may have some peroxide at home and you think, oh, this is a good dental wash.
Oxidative, given the name, the oxidative, and over oxidation of soft tissues will start to because peroxide has a bubbling, effervescent effect in the mouth, and it can over oxidize the tissue. And when we over oxidize anything, then we can trigger some other painful, harmful side effects. So yeah,
we're going to move away from cleaning and go to something else. But a thought just came to my mind. As a child, growing up in strange circumstances, just put it that way, our parents used to sometimes substitute for the toothpaste charcoal. How good, and I saw recently some toothbrushes called charcoal base. So how good is charcoal for cleaning the teeth?
well, charcoal is a very good carbon. Basically, it is just nothing but carbon, and anything that is going to be used to remove organic debris, anything organic. If you go back, if you study chemistry, organic chemistry, it's all carbon based. So carbon based molecules are the beginning of biochemistry, right? So charcoal is a carbon, and it will attract other carbon. So when you use it as a toothpaste, same way as if you use baking soda or baking powder, this carbon is attracted to the stains and the molecules that are on your teeth, the bacterium. And so the charcoal will bond with it and help remove it off of your teeth, because the sticky plaques rely on their stickiness to cling to your teeth, the smooth, flat surfaces of your teeth. And carbon and charcoal is very, very good at removing plaques and stains, because it breaks that bond of stickiness to your teeth and allows it to cling to the charcoal and rinse and be rinsed out of your mouth. So it seems counterintuitive to put black things on your white teeth, but it does work.
Okay, wonderful. Now, Doc, as indicated, we want to kind of move away from the basic stuff and go to some heavier things. Let's begin with gum disease, let's say. What is it? How is it caused, and can it be cured?
Okay. Gum disease, or periodontal disease as we call it, it's a progressive disease. So it starts small and gets worse and worse and worse. And the primary cause of gum disease is those plaques, the sticky plaques we talked about. Not the ones that cause cavities, because that's a different bacterium, but the ones that stick to your teeth and cause gingivitis. And that's the first step of periodontal disease. When you have a swollen, bleeding gums, and usually starts in the late adolescence, early teen years, where your gums are swollen, and if you are not getting those plaques removed on a daily basis multiple times, we talked about the brushing and flossing last week, 2 to 3 times a day for brushing, at least twice a day for flossing. And I always recommend, don't brush your teeth immediately after, but get a floss pick or some kind of floss that you can use to get the food and debris out from between your teeth, because you can do that immediately and it doesn't cause a harmful effect. But the heavy duty brushing, you want to wait at least 30 minutes after mealtime. Gingivitis is the beginning part of those plaques. Okay, that stage gets progressively worse when we advance to periodontitis. At that point, the inflammation of the gums, because periodontium means bone, gums, and structures around the teeth, the periodontium, right? So those structures are irritated by these plaques that stay on your teeth if you haven't, cleaned them and flossed them properly. And then that begins an inflammatory response with the body. And inflammation starts breakdown. And with the inflammatory response, it breaks down gums, it breaks down bone, and eventually it'll break down the structure that's holding that tooth in, and then the tooth become flexible and movable, which they're not meant to be. At least not on a large scale. You shouldn't be able to see or feel your teeth move. That's periodontal disease at its most severe conclusion. It can be stopped at any point of the progressiveness of the disease, but at certain points it's not reversible. At gingivitis, it's reversible. At early periodontitis, slight bit of bone loss, slight bit of gum recession, it's reversible. When we get to more than 3 or 4 millimeters of bone loss, more than 3 or 4 millimeters of recession around the gums, which is, from the enamel, there is a junction into dentin, which is the root structure. Once you've had recession down below that enamel into the root structure, then you're exposing dentin of the tooth, which was supposed to be covered by bone and the periodontium, which is the bone and gum tissue. And so when those structures are destroyed to a point, you cannot reverse the process without doing massive surgical procedures.
So prevention then is what we are supposed to be seeking.
Yes.
To aim towards.
Absolutely. That's the first step. Prevention is the first step of the cure. Stopping it from getting progressive, stopping it from going on and continuing, and then trying to get the tissue to heal back as good as it possibly can. At that point, you need to discover that you have the disease, stop the process, and then continue to keep the cleaning process going on a daily basis. Sticky plaques turn into hard calcified plaques. The calcified plaques can only be cleaned off at a professional level. And if we don't clean those off, those colonies of bacteria are still on the teeth, just leaking toxins. And those toxins cause that inflammation, which continues to destroy the bone and periodontium.
So on a regular basis, should a person floss every day, once a week, 2 times a week? What's the recommendation?
I recommend at least twice a day.
Flossing.
Flossing, yeah. At least twice a day, if not 3 times a day. I don't expect you to carry a floss pick in your pocket, but you can get a toothpick, and you can, especially the flexible plastic ones that you can find at the pharmacy, and you can use that after every meal to get the food and debris out from between places where your brush won't reach. Then use your brush later after you've given it the 30 minutes of waiting time. And I like flossing morning and evening, using a toothpick at lunch. This is my own personal habits, and then brushing 3 times a day.
Okay. I mean, I'm so tempted to ask another question, but I want to deal with even heavier stuff. So if we do have the time, I'll come back to that. But
okay.
Sometimes we see people's teeth growing out of line, crooked. What causes that? And can it be corrected?
Well, it depends on what is the underlying cause. Sometimes growing out of line, we're talking as we get older, that's usually a process of periodontal disease and wear and tear on the teeth. Whereas when we're younger, it's usually a process of how you inherited your teeth, your genetics, and whether your jaw size has the room to fit your teeth. A lot of times we can blame our parents for very many things, but when it comes to teeth, you can inherit small teeth from your mom or dad, and you can get a large jaw from your mom or dad, and you put those two together, and sometimes it'll develop spacing, which will allow those teeth to move and rotate. Sometimes trauma can cause those rotations, and sometimes the teeth are overcrowded because there's not enough room for the size of teeth in the jaw to fit into the jaw, and that's when we have to do orthodontic manipulations. And yes, it can be fixed, usually through manipulating things orthodontically with wires and brackets, clear liners, and plastic retainers.
So in other words, I can have a situation where there is not enough space to fit all the teeth that my mouth has, and they therefore force against one another and cause some kind of crookedness.
Right. They'll rotate to make space, and sometimes one will move forward or back with the other. I've seen someone where one tooth is just kind of jutting out because it didn't have enough room, so it popped out to where it had room to grow, and the other teeth grew in behind it and closed that space. So then it didn't have room to come back into where it normally would rest.
So if that is the case, can it be corrected? As opposed to if what we are experiencing is because of irreversible periodontal disease.
Right. It's more easily corrected at a younger age because we're still growing and the body's used to being manipulated and changed because it's still going through a growth process. It still can be done in adulthood. It's going to take a little bit more time. It's a little more complicated, but it's doable. I had a professor, by the way, just quick side note, but he had a professor who was 75 years old. His daughter was in the dental school class for orthodontics, and she just graduated dental school a couple of years earlier, and he decided he was going to get braces done because he'd always wanted to straighten his teeth. He did it at 75.
Wow. And what?
Yeah, he's 90 now, and 95 now, actually, and he's looking pretty good.
A word on braces, because we probably will not get the time to come back to this. I suppose there are different types of braces, and what's recommended if I want to straighten my teeth, or somebody else wants to do that. You did say earlier is better, but an individual now listening to this program realizes, hey, I can get my teeth corrected. You know, I want to have a nice, good smile. What's the recommendation?
Well, every individual has a different plan, okay? And it shouldn't be like one size fits all for everyone. Brackets and wires was the tried and true method, and it's one that's been around for decades, if not 100 years. The clear plastic liners are a newer method, but they do just as good a work, and they do the proper way of aligning the teeth. In certain situations, you want to go to do both. You want to do wires and brackets first, move it into a proper position, then use the clear liners to pull it back into to place. After you've expanded the jaw, you want to you made space for the teeth, then you want to bring the teeth back together in a proper alignment. And sometimes, using both wires and clear liners is a way to go, especially when it's a more complicated process.
Okay. Thank you so much, Doc, for that useful bit of information. Again, we're asking lots of questions this afternoon and covering various subjects because you will not be on next week, so I'm trying to push everything in. Why do some persons experience sensitivity to cold? Does this mean that the teeth are losing their vitality?
No, it's not so much losing vitality as much as it's been losing periodontium. We talked about that. The bone loss can cause the gum loss. So the gum loss, once it's gone beyond the head of the crown of the tooth, which is that really nice thermally protective layer of porcelain, is how you replace it. But that really nice enamel protects the tooth. Once the recession has slidden past the enamel and has gone into dentin, dentin is a very porous but flexible structure. And because it's porous, it allows the sensitivity of cold and hot and spices and other things to reach the nerve more rapidly. So the tooth has lost its thermal protection when you have recession and dentin is exposed. It's that dentinal exposure that causes the cold sensitivity. It doesn't always mean that the nerve's going bad. It just means that the nerve's more exposed than it ever has been.
Oh, so if a person is experiencing this, should they be alarmed? Do they need to come into their dentist and say, hey, I've observed such and such? What do we do?
Yeah, absolutely. If your tooth is sensitive and you haven't had someone explain it to you that, hey, this dentin is exposed, meaning that the pathway to the nerve is much more rapid with hot, cold ice creams in particular, and spicy foods. If your dentist hasn't explained it to you, then you need to know that recession of your tooth has exposed an area, and there are ways for the dentist to go in there and to paint on some medicine that will help close those tubules and surround them and protect them from hot and cold. It's never going to be as thermally protective as your natural tooth was before it had exposure to the dentin, but it is helpful at diminishing it. It's just one of nature's signs that something's going on, and that's for sure a sign, if you haven't been into your dentist lately, that you should go visit.
Okay, bottom line is we should not wait too long before we see the dentist.
Don't sit at home. Better to complain to your dentist because there's something they can do to help you.
Okay, wonderful. Now, let me ask this question. I've heard people talk about a really bad toothache. I have to say I've heard, I can't remember experiencing one. And they tell me that it can be really very painful. What causes this? I've heard people saying, I didn't sleep last night because I had this real terrible toothache. So what causes that? And what is it saying?
So what it comes down to is the inflammation of the nerve. They call it pulpitis. Pulpitis is a word for inflamed nerve. Pulpitis can occur from really bad periodontal disease, where your gums and your nerve are infected from the recession of the tooth, from the calculus on the teeth, from that inflammatory response. The other thing can come from caries, whereas you've got a cavity that's into the nerve, or the nerve is actually dying from trauma that you've had in the past. And anytime you've had trauma on a tooth, your nerve can start to die. And when that occurs, you can get pulpitis. Now, pulpitis is just a swollen, inflamed nerve. And that toothache can be severely debilitating, because the nerves that innervate your teeth are direct branches off the trigeminal nerve in the brainstem. And there is no stopgap when it comes to pain from your tooth to your head. It's immediate. It's instantaneous, and you feel it. And it can be very debilitating to the point where you don't want to get up out of bed. And it can be either periodontally or keratogenically related. So cavities or periodontal disease, gum disease, can both trigger toothaches to the point where you can't function. And usually this is, from trauma, from cavities, or from periodontal disease. Those are the three main things that can cause a debilitating toothache.
So if I don't bother to examine my teeth, I may brush and not floss, and I don't take the time to check my mouth to see that there's a cavity developing. Something can happen without me knowing, and if I'm not visiting the dentist, then I can wake up one morning and realize, hey, listen, something is terribly wrong with my mouth.
Yep. And it can be overnight and instantaneous.
Okay.
And looking normal to severe swelling to the point that you can't open your eye, because the swelling can get so big it can close your eye, and the swelling down on your neck can get so big that it can shut off your breathing if you have a severe toothache that you've let go for too long.
Oh.
So that's about the only medical condition that can cause from dentistry that can cause death, would be if you had a toothache in the lower jaw and the infection got down into your lower triangle. We call this the triangle of death here, right here, because it can cut off your airway and stop you from breathing. It's called Ludwig's angina, is a big word, but it's just a swelling of the neck that could have been controlled by either fixing the tooth or removing the tooth.
I'm talking about removing the tooth. If a person has a cavity, when do you fill it and when do you remove it? I don't know if my question is appropriate, because you may tell me, hey, that's not how to correct it. There's somewhere else, something else. You're the dentist here, instruct me. But and what are the circumstances under which a person may need to remove their teeth?
Okay. Well, there's a place what we call restorability. If the tooth can be restored to normal function, it's restorable. If we can get the tooth back to restorability by whatever means, then and it's a functional tooth where it's in your chewing where your chewing process that you like to use is, or it's the side that you prefer to chew on. If we can get it back to restorability, yes, we should do it. If the cavity is too deep, you're going to end up into the nerve. If the nerve is into it, if there's caries or cavities into a nerve, it's into that place that we have to decide, are we going to restore it with a root canal therapy, crown on top of that to protect the tooth from fracture, because once you've done a root canal therapy, you need a crown. Teeth tend to fracture. If you don't get a crown on top of a root canal tooth, they'll tend to fracture or chip off and break away. and then you have a worse situation than you had in the first place. So if it's restorable, if it's a functional tooth, if you can save it with a root canal and crown, or if you can just save it with a filling, absolutely save the teeth. If it's a tooth that's off by itself, or it's a tooth that's so deeply decayed that there is nothing above the gum line, or we call there is no coronal aspect to a tooth, if it's broken off or decayed below the gum line at bone level, it's non-restorable. And at that point, you should extract it. If it's a dysfunctional tooth or a tooth that's rotated into the wrong place, sometimes we'll actually remove teeth if we have to, as a last resort for orthodontic movement, to make space for teeth to move into a proper position. So there are a number of reasons to remove teeth, but I'm of the belief that it should be a last resort, not the first choice in restorative measures. Because once you lose a tooth, what we do to replace it is never as good as what God gave you in the first place.
Okay, and of course we're talking about here your second set of teeth.
Yeah, baby teeth will all come out. There'll be 20 of them.
Okay.
20 babies come out. By the time you're an adult dentition, you're around 11 or 12 years old, sometimes 13. But very rarely do baby teeth last longer than that. And there are cases where an adult tooth never grows into the proper position. So some baby teeth will be retained into your 30s and 40s. And I've seen people have a baby molar that never had a tooth come up after it. And this particular patient had a baby molar and she was 55 and still was functional, still working. The roots were getting shorter and shorter, but it was still in place and doing a good job.
Interesting. I suppose there are irregularities in all aspects of life. It may be appropriate for me to ask this question that someone just posted. If you extracted a tooth and do not replace it, will the empty space affect other teeth?
Yes, is the best answer I could give you. That will it affect them negatively? Most of the time, there'll be some sort of consequence or some side effect. But what happens is teeth are fluid in the mouth, and they will start to move and close into spaces. And sometimes the opposing tooth on the opposite jaw, let's say it's an upper tooth that was extracted, or sometimes a lower tooth. If you're missing a lower molar, the upper tooth will start to extrude down into that space that doesn't have anything anymore, and the other teeth will collapse and tilt. And so rotation, loss of space, and what we call extrusion of the tooth opposing it can all be consequences of losing a tooth and not replacing it. Now, is it necessary to replace a tooth every time? No, but it always means that your teeth are going to be shifting into a different position than they were in the originally, and you better be prepared for that.
So if I take proper care of my teeth and well, let's say oral health, or because I want to be general, you know, I brush, I clean my tongue, I do what is necessary, I visit a dentist regularly. Is it possible that I could live into the 90s and even 100 with all my teeth?
Well, I'll give you an example I have in my own family. My mom's 90, and she has all of her original teeth, all 32 of them. She had space in her mouth for all of them, and she still has them there. So, yeah, it's completely possible to keep your teeth into your 90s. And for as long as God has you blessed on this earth, you can keep your original teeth if all goes well. And, you know, there are a number of different things that cause traumas. I don't have 4 of my wisdom teeth because they were coming in crowded, and they were all taken out while I was in dental school. That's a whole nother story. But, you know, so I have 28 out of 32, so that's not too bad. But, you know, it just depends on how you take care of it. It also, you know, depends on what your access to healthcare growing up was, because a lot of damage can be done in young adulthood before we even know that anything's happening.
I mean, that's an interesting thought that I kind of want to follow up on, but before that, because you mentioned the wisdom tooth and having to extract, because some persons are affected by how the wisdom tooth grows,
Yes.
um, and and may need to extract them. When does a dentist decide, hey, I need to remove this tooth or this one can stay? And
Well,
I'm
right.
adding something to the question so that when I remove it, um, does it impact my nerve? Somebody once told me that they removed the wisdom tooth and they began having serious headaches. I don't know if that's just coincidence.
Well, a number of different things can go into headaches, so not always just nerve pain. When you have wisdom teeth removed, if it properly heals, there is no residual nerve pain or damage that can be caused from it. If it heals improperly, or if you have a dry socket, etc., after a wisdom tooth removal, then you have a possibility of having some complications, and it can definitely trigger a headache if you're having a dry socket, which is basically exposed bone and it hasn't healed over. But it's not usually nerve damage that you have; it's bone pain that's triggering the headache that you get after wisdom tooth removal. Only time wisdom teeth have to be removed is if they are causing the other teeth to dysfunction, or if they're causing a cavities problem. Say a tooth is impacted, say it's tipped forward rather than coming in straight up. If it's impacted into the back teeth and pushing them forward, it can actually push them to the point, because it's growing, that the front teeth will start to uh, rotate or buckle to allow for that pressure of the space. So in that case, removing the wisdom tooth is going to take the pressure off the front teeth and allow them to sit naturally in the dentition the way they were intended to.
Okay, very well. Someone is asking, is periodontal disease contagious?
Yes, but contagious like herpes? No. But it's contagious because it's an inoculation of bacterium that you get probably from childhood. And I talked about that a little bit last week, but we can, by sharing food, utensils, etc., we can swap spit with family members or non-family members who have periodontal disease, and then that bacteria becomes familiar to our mouth. Then our body's going to stop fighting it as strongly as it will. Our immune system says, "Oh, this is normal, not abnormal." So if you have a tough time cleaning and flossing and brushing, if you've been inoculated by someone who has a periodontal disease, because it comes through the bacteria being introduced into your mouth, then yes, it's contagious. But is it contagious like you're going to give it to someone immediately? No, not especially if they don't have good oral hygiene. But you do want to look the gift horse of your partner in the mouth and say, hey, we should both go to the dentist and get cleaned up.
So, so,
Because
so, so the young folks who are listening to us and are dating, seeking a mate, they should check out the teeth.
that's right. That's right. Teeth and bad breath, right?
Yes, interesting. This is very interesting. I did say that I wanted to kind of follow up on something you mentioned there, when speaking about um the care that one gives, particularly with respect to how careful I am during, let's say, my teen years, with respect to mouth care and how that can impact me in later life. I want if you can just say a word or two on that, because sometimes we can be very careless young, not giving attention, eating the wrong things, etc. And then, we get wiser much older, but then the damage is already done.
Right. So as I mentioned earlier about periodontal disease, it is a progressive disease. It is the number one disease that people over 18 lose their teeth. So that we should always be conscious and aware that this is the number one disease causing tooth loss. This is something that I need to prevent against. But by the time we're adults, or even have all our adult teeth, so starting in teenage years, we should be good at cleaning, brushing, flossing, keeping the gum from being swollen and bleeding. If gums are swollen and bleeding, there's a underlying cause to it, and we need to go figure that out. Sometimes you need a professional cleaning. Sometimes all you need is a little bit more cleaning and care of yourself at home.
Okay. Very well. Good counsel. Now, if I can ask you you did mention in one of your earlier responses a few minutes ago, you used some terminologies that I wanted you to explain. You mentioned crowns and bridges and what, so can you explain the difference between a crown and a bridge? What are these things that you're talking about? What is what? When is it necessary to have a crown? When is it necessary to have a bridge? What is a bridge anyway?
So good. It's good thought. But if you think about it, a bridge is what? Spanning two. You have two teeth that have an empty space between them. You'd have to span it with a bridge, right? So that's what a bridge is in connotation to a crown. So it's basically two crowns spanning a third space, which is an empty crown. So it's replacing a missing tooth with a bridge so that it can have a chewing surface in that area. But then you have the crowns on either side. Now, a crown is actually a protective, we put it like a cap over a tooth, protective device. We used to make them out of gold, or you would make a gold crown on top of the tooth to wrap all the way around it to protect it, because too much structure was lost from cavities. Okay, the only reason you need a crown is because more than 2/3 of that tooth structure is already an existing filling. If your filling is more than natural tooth structure that you have left, you probably need a crown. And the best line of thinking in this, and it was done by a number of dentists through research over the years, if more than 2/3 of the tooth is filling material, more than likely you need to wrap that tooth around to protect it from fracture and wear. Because filling material will not stop it from fracturing, it will just replace what missing material is there. So if you've had a cavity and you had multiple cavities over time, and the filling got bigger and bigger every time you replace that filling, eventually you'll need a crown to protect it and wrap around it. The old Egyptians used to actually wrap gold and copper wire around the teeth to keep them from splitting. And so that's kind of where crown started.
If a person gets a tooth broken, what's the solution? Is that a crown that is going to be necessary at that particular point?
Only if it's a huge portion of that tooth. Say if it's chipped, just a tiny chip out of the one edge of the tooth, that doesn't always necessitate a crown. But if you're talking where it's been split in halves or quarters or thirds, and a large fracture of enamel has come off, then yeah, that's usually necessary for wrapping it around with the crown. And sometimes actually going on in and having to remove the nerve, where we do a procedure called a root canal. So crowns covering teeth to span bridges, span spaces, and crowns take care of a single tooth.
So again, why I'm seeking to understand why a bridge and not just a crown. Is it that the crown will not stand on its own, and so you have to hold it in place with a bridge, or are they used for specific circumstances?
Bridges are just used to replace missing teeth. For whatever reason, that other tooth was unsalvageable, couldn't come out.
Oh,
now,
okay.
Modern ways of replacing bridges are by doing dental implants, titanium post in the position, inserted into the bone where that missing tooth was, and then you can do a single crown restoration on that titanium post. That's an implant with crown. that would replace a bridge. The nice thing about bridges is you don't have to wait for an implant to be done. The downfall of the bridges is you have to cut enamel off of that natural tooth to make space for that bridge. And so you have to cut that tooth down a little bit, 2 to 3 millimeters in some spaces, 1.5 to 2 millimeters in other places, to reduce that full tooth to a smaller size so you can fit a cap over it. That's what you have to do anytime you do a cap. Well, if you have to do that on one tooth for a single crown, you have to do it on 2 teeth for a bridge. And so both teeth have to be reduced. And so if you can keep whatever God kept in the first place, then an implant's a better position. Just unfortunately, implants are more expensive than bridges in most cases.
Okay, now you mentioned filling. We have been talking about filling.
Yes.
What material is used in this process? Yeah, let's leave it at that. What material is used in the process of filling?
In the past, we used to use a lot of silver fillings. Silver is a very functional and good filling for interim long-term restoration. When I mean interim meaning it's going to have to be restored again sometime, and long-term meaning that it can last for 5 or 10 years. I've seen amalgam fillings that have lasted 40 years. The silver fillings were very good functional fillings. They did a couple different things to the teeth that we in modern days don't appreciate. And what happens is they tarnish, and as they tarnish, they become antibacterial, because silver tarnish is a natural antibacterial solution. So the tarnish of the silver was helpful at retarding bacteria from regrowing, but that tarnish also turned everything dark black rather than a polished silver. So polished silver is much prettier than the dark black, and it will stain your tooth black. And eventually, over time, silver will imbibe water, and it causes cracks and fractures in the teeth. That's the other thing we didn't like. So then we'd end up having to do a crown later. Whereas more modern fillings use a composite resin that we get from tree resin. And the tree resin that we use, we can fill it with any color we want, so we can match it to all the most natural shades. Now, tree resin is nice filling material as an interim long-term solution too, but it has to be kept clean. The thing that is negative about the tree resin is it is actually bonded to, it's not a negative that's bonded to, but it bonds to the tooth chemically and is not held in physically like silver fillings were. They had to be held in with different kind of preparations to lock into the tooth. Whereas the resin will actually bond into the tooth, but it is more susceptible to recurrent decay because it doesn't have the natural antimicrobial abilities that silver did. So you're more likely with tooth-colored resin fillings to have recurrent decay more often, especially if you have a caries problem, than you would if you had old silver fillings in the past. But both of those are fillings of small holes, and they're never meant to be long-term solution for covering the whole surface of the tooth.
I also heard, yes, very clear. You also mentioned root canal.
Yes.
Yeah, what is that?
Okay. So, as I was saying earlier, if the decay or fracture of a tooth is so deep that it gets into the nerve or exposes that nerve pulp. If you've ever seen the anatomy of a tooth, there is a pulp in a nerve, and inside that pulp tissue is nerve, blood vessel, capillaries, arterial. So it's a complete system, just like any organ in your body would be, because it has nerves and capillaries. When pulpitis occurs, it can be either reversible or irreversible. Irreversible pulpitis means the nerve's going bad and it won't stop hurting until we take it out. That means that tooth needs a root canal. Reversible pulpitis means it's a little irritated. If we give it some time, put some medicine on it, we may not have to do the root canal. But when you get to the point you have to do the root canal, you have to open up that nerve chamber. Now, if it's opened up from fracture or if it's opened up from cavities, either way, it's opened up. and that's a direct source of infection into the bloodstream. So we want to eliminate that process from happening. So what a root canal does is it removes the nerve from that root structure. Sometimes those teeth will have 3 or 4 roots, especially in the big molars in the back of the teeth, back of the mouth. And we remove the nerve and we clean it out with irrigation and mechanical instruments. And once it's cleaned and shaped and irrigated, free of bacterium, then we'll go back in and use something like a inert product called gutta-percha. Gutta-percha is natural rubber. And we'll go in there with a sealant and something that's biocompatible with a sealant, and then we pack in the little rubber into the canals and then heat up the rubber so it'll expand slightly and seal those canals top to bottom from getting reinfected. Now that tooth at this point has no nerve in it, but it's still a functional tooth. So what we've done is we've saved the root structure, which is 75% of the tooth is root structure down in the bone. We saved that root structure so we could put a crown on top of it and make that tooth a functional tooth, where in the past would have had to have been extracted. And sometimes those root canals will fail and need to be retreated because there's too much infection. And sometimes they'll work perfectly and you'll have that tooth for the rest of your life.
Very, very clear. I think again, you're re-emphasizing the point that take care of what you have, and then you're going to save yourself a lot of trouble, and I suppose a lot of money as well. As a dentist, Doc, this question just popped into my mind. As a dentist, what is one of the most difficult procedures that you can do, or that you have to do?
For me personally, I think one of the more difficult procedures is just extracting teeth, but they can also be some of the easiest procedures you've ever done too. It just depends on how much bone is left and whether you have to go in and dig the bone out of the tooth tips, the root tips out of the bone. That's the more difficult procedure. So it can actually be the easiest procedure you have in dentistry or the most difficult. It just depends on that individual and how badly broken down that tooth is. Root canals are a difficult procedure for a lot of people. I find them very fascinating and not simple to do, but it's kind of one of the things that I thrive at doing. And I really enjoy being able to make a tooth that, was getting ready to be put on the waste heap for extraction, and taking it and bringing it back to restoration where we can actually have a functional tooth in the mouth for long term.
Okay, wonderful. Now, if I can, in the next few minutes that we have, get back to some simpler stuff now that you have spoken about all of the technical. How often should one change his or her toothbrush?
I think most dentists will recommend every 3 months. I would say, depending on how much you use it, every 2 to 3 months. I have been able to, keep a toothbrush for 6 to 8 months if you, wash it properly, just like you wash your dishes, clean it out. I like to nuke it in the microwave to kill all the bugs off of it. But I wouldn't say more than 6 months would be, it'd be more than enough. With whether it's a mechanical toothbrush head or the actual, handheld toothbrush, 3 months is recommended.
Okay, I have a question here back on root canal. I have some more toothbrush questions, but just so that when we get off of this, this question asks, a listener is asking, if an abscess can develop in a root canal. Did you get that?
If an abscess can develop?
If an abscess can develop in a root canal.
An abscess never develops in a root canal. An abscess always develops outside of the root canal, in the bone tissue, in the soft tissue. So the abscess can develop whether you've had a root canal treatment or not, depending on how much infection is present and how much your body is able to clear it away. It's the immune response of your body is why there's an abscess or not. But yes, after a root canal abscess, if the abscess was already there and it never cleared up, it can get abscessed again. Or if there is a connective tissue abscess below that nerve tip that you've already sealed, and we couldn't see it on X-ray. So sometimes there's a treatment. It's called a retreatment of root canal, and if it's called an apico, apex meaning the point, right? The point of the tooth, the root tip. We call it an apicoectomy, and so you can go in there and remove the tip in that abscess tissue that's clinging to it by cutting a window in the bone up above the tooth, and then you can seal it back just like you would for any kind of bone graft, and patch it over with and let your gum tissue heal, and then the bone structure will heal around it. So apicoectomy is a retreatment of an abscess that has never healed properly. So yeah, you can get abscesses in a root canal too, but it doesn't happen very often. And when it does, there are processes that you can do to still save the tooth. So, and we're talking heroic processes, if it's a functional tooth and if it's in a really good spot in your dentition that it shouldn't be lost, then it's worthwhile to save it. If it's, like your wisdom tooth or a tooth that you could bypass with the bridge or maybe put an implant in later, then after you've done a root canal and it reabscesses again, then, we've done as much as we can heroically to save that natural tooth. Then it's time to look at replacing tooth. So the replacement of teeth is never as good as, like I said, what God gave you in the first place. So it's always going to be more difficult to chew, and it's not going to be as strong as your natural tooth.
Okay, so back to the basics again. You say the adult has 32 teeth.
On average.
On average, 4 wisdom, I understand, correct?
Yes.
And then the rest. Now, I was asking you about toothbrushes just now, and the question was how long, but now some toothbrushes have soft, some have medium, some have hard. What's the better type?
Okay, I never recommend for anyone medium or hard toothbrushes. If they like them, I say go ahead and use them, but it's not going to be as functional as a soft toothbrush. It's not going to be as easy on your dentition and your gums. And so what I like to teach people is to gently tight little circles between the gums and the tooth on all teeth all the way around. So kind of at a 45-degree angle, nice little circles. Just use those bristles to brush in there and get them to brush food and debris off. Okay. If you want to do gentle, tight little circles, you want to use the gentlest mechanism possible. So I always recommend soft toothbrushes, especially if you've had periodontal disease or you have a recession problem. People who have recession problems can actually make it worse by scrubbing too hard and in the improper manner. So never a medium, never a soft tooth, or never a hard toothbrush, only soft if you've had periodontal disease.
Sometimes, Doc, the teeth become stained. We know sometimes tobacco use, etc., but I suppose over time, other things. And people come in for whitening. Now, I'm not talking about general cleaning. I'm talking about whitening.
Right.
Is teeth whitening healthy? Does it impact the strength of the quality of the teeth in any way? What's your counsel on this?
If done properly, whitening doesn't do anything to harm the natural tooth. But what it does is we We use there are a number of different substances we use to whiten, but some of them are peroxide and gel. We talked about peroxide earlier. You can use peroxide to whiten your teeth, but you don't want to get it all over the gums because it's destructive of organic material. Whereas it will not destroy the enamel, but it will penetrate the enamel and start to whiten the dentin. Most people, as they get older, the dentin, which is the under the enamel structure, that's what discolors, and that's what causes the darkening of teeth. And so by using peroxide and letting it leach through the enamel and whiten the dentin, it will whiten that tooth without destroying the enamel or the dentin. But it can make the teeth hypersensitive. So if you have cavities, you should never whiten your teeth until those cavities are fixed. And you should also just consider, how much do I need to whiten these teeth and how much do I want to? And am I going to be careful about it? That's another thing after whitening. You shouldn't go in and brush your teeth right away after whitening, at least not with any harm, with anything that's going to scrub the enamel off, because the enamel has just been leached through with bleach to lighten it. So you give it some time, and then after the I usually give it 2 to 3 hours after whitening. Then you go in and you put fluoride on the teeth and allow that teeth to the teeth to remineralize with that fluoride, and keep that the lightened appearance of the teeth that you have. People usually need to do whitening every 3 to 6 months to redo it, just to keep it lighter and lighter. And most of that is coming through with the dentin, because dentin changes with what we eat and as we get older. So that's why you notice older people start getting more and more yellow teeth because of what we've had in our diet.
Well, Doc, it has been really great talking with you. Time has expired. In fact, we are a couple of minutes over. I apologize to the technicians for this, but I really want to thank you for taking your time to share with us. Again, Dr. Edwards operates at the St. Kitts Dental Clinic. If you are in St. Kitts, if you're in Nevis, please stop by and get your teeth checked out. I can tell you he's one of the best dentists in the place. I have had him treat me, and it has been absolutely phenomenal. So please go by. Now, we thank you so much, Doc, and one of these days we will have you back on Let's Talk, hopefully. I do want to say that next week we are going to be talking about something else. Next week we are taking a different focus. We are going to be looking at issues relating to the church, and let's put it this way, and I'm sure that many of you will get a sense of excitement about what we're going to be doing. We are looking at the change in, well, should I say, evangelism now and then, is what we're going to be talking about next week. We'll be talking with Evangelist Roosevelt Daniel. Some of you know him, many of you know him. We are going to be asking him about his own personal journey, and then looking at evangelism now and then. So we may have him for 2 weeks. That's just a peep into what we're going to be doing next week and the week ahead. So please be careful to join us next week, same time, as we continue this very intriguing series, Let's Talk. We talk about issues, we talk about health, we talk about all things impacting church members and the wider community. It was a pleasure having Dr. Edwards with us. Doc, again, thank you. God bless you. May your ministry continue to be fulfilling and satisfying as you serve in the South Leeward Conference. It was a real pleasure talking with you.
Thank you. Thank you very much.
So folks, that's all our time. Bye-bye until next week.